Good afternoon, good morning, good evening, wherever you are. Welcome to today's event, which will be exploring public expectations of healthcare in Asia Pacific. My name is Arun Sudhaman. I'm editor-in-chief at Provoke Media, and we're very happy to be collaborating with Sandpiper Health on today's event, which will focus on a new study, the Sandpiper Healthcare Tracker, an analysis of public expectation in Asia Pacific. The research examines people's healthcare priorities and satisfaction with healthcare services and what this means for policymakers and healthcare organizations more widely. As you probably don't need any reminding, the importance of healthcare policy has come into sharp focus as the world continues to battle the COVID-19 pandemic. And of course, the research is a springboard to discuss wider challenges and solutions, the role played by communications, the importance of collaboration, the patient voice, and much more. So presenting the research, we have Saskia Kendall, who is director at Sandpiper Health. She'll spend around 15 minutes running through the research findings. We will then discuss the findings with our panel, which features Dr. Ritu Jain, who's a board member at DEBRA International, also serves on the boards of the Asia Pacific Alliance of Rare Disease Organizations, Rare Diseases International, and International Rare Diseases Research Consortium. And she's also a sociolinguist at Nanyang Technological University. We have Kylie Park, who's head of corporate affairs for Amgen in Asia Pacific, where she leads Amgen's communications and advocacy strategy. And we have Robert Magyar, who's a director at Sandpiper Health in China, where he also leads the life sciences team.
So this is a really exciting opportunity for us to talk about this research that we've actually been doing for the last 2 years. But I just wanted to take a step back and talk about why it is that we've embarked on this research project. We know that expectations and prioritization of healthcare is changing over time. We know that we have an aging population in Asia Pacific. We know that there's an increase in a variety of chronic diseases, and this is driving changes in the way that we are thinking about healthcare. So in 2019, we embarked on this project. We have the Healthcare Tracker is based on a survey of about 12,000 people across the region. I'm trying to understand what their changing attitudes towards healthcare are. And we also were able, because we were able to do it over 2 years, to see what the impact of the COVID-19 pandemic has been on people's prioritization and expectations of healthcare. And we saw a dramatic shift in people's prioritization of healthcare between 2019 and 2021, which was almost certainly driven by the pandemic. So healthcare in 2021 was a top policy priority in almost all territories that we checked. So that's 10 out of the 11 territories. And this was a dramatic change from 2019, when healthcare, although a top priority in many places, only about half of priorities, half of the territories had healthcare as a top priority. We also looked at satisfaction in healthcare services and how these might have shifted due to the pandemic. Satisfaction is a really good way to measure whether or not health services are actually meeting people's expectations. So we looked at satisfaction, and across the region, we found that an average of 61% of people were satisfied with public healthcare services and 62% in private healthcare services. However, we saw dramatic shifts and a huge regional variation in levels of satisfaction. Singapore had the highest satisfaction of all of the territories we looked at. And we also saw a massive jump in satisfaction rates between 2019 and 2021, and almost 17% jump in satisfaction, up to 82%, which is an incredibly impressive, very surprising jump. On the other end of the spectrum, we have Indonesia, which saw the biggest drop in satisfaction over the last 2 years, almost 20% drop in satisfaction with public healthcare services. And again, I think this is almost certainly due to the COVID-19 pandemic and how it has ripped through the country, the impact that it's had on healthcare services, how much pressure and severe impact that it's had on healthcare services and in terms of mortality. What was the main driver of satisfaction? The number one reason for satisfaction was the level of healthcare professional expertise. And this in some ways isn't necessarily a surprise. People value their healthcare professionals and trust in them is very high when you look at general public attitudes. In terms of drivers for dissatisfaction, cost came out the highest. In 10 out of 11 territories, cost was the main reason for dissatisfaction. But what we found is that overwhelmingly, government was most responsible or viewed as most responsible for financing healthcare systems. There were some differences across the region. In Australia, this figure rose to 80%, probably recognizing the very well-established public health system in Australia. But also there was a slight increase in expectation in some areas. So in Malaysia and in China, we saw quite significant increases in expectations that government should be paying for healthcare services. So we, as well as asking whether or not healthcare should be prioritized, we also asked people what should be prioritized in terms of healthcare and in terms of funding and resources by government across the region. What came through very strongly was that healthcare infrastructure funding was really important and seen to be a key priority. 63% of people highlighted it as something that should be a priority. This was followed by prevention of ill health and access and investment in medical technology. We also asked whether or not what specific disease areas should be prioritized in Asia Pacific, asking people to identify their top 3. So what came out very clearly is that cancer was a top priority. This was true in 2019 and in 2021. People in 9 of the 11 territories believed cancer should be a top priority for government funding. And particularly their concerns were around the severity of the disease, the significance, and the cost of treating the disease. But the pandemic has also really affected people's attitudes to infectious disease and the potentially infectious disease outbreaks. But also there was a real recognition around almost 60% of people across the region that pharmaceutical companies and bringing the innovation that they brought to overcome the COVID-19 pandemic had played a really critical role in the fight. So this potentially is a major opportunity for pharmaceutical companies to understand and recognize the importance of this reputational change for them. So what do all these findings mean and this data means? We've kind of highlighted 4 key recommendations that we think are critical. Most importantly, improving access to care is really important, and all stakeholders working in healthcare are part of the solution. And it's important that healthcare organizations are collaborating and supporting policymakers to improve access.
Thank you very much, Saskia. Yeah, some really interesting insights there, and we will we'll get into many of them, I imagine, in the discussion to follow. As mentioned previously, please do pose any questions you might have in the Q&A box, and we'll try to get to those as well. But if I could start perhaps by asking each of our panelists for their initial responses to the findings that were perhaps most pertinent to them, that interested them the most. I can give you each around 3 to 5 minutes.
It's important that we think about our healthcare system more from the perspective of a predict and prevent model. So how can we actually improve the health stock of our community overall, so that in fact, we are better placed to withstand these sorts of health shocks going forward by making sure that, that people are prevented from becoming terribly ill. I think also encouragingly for us as a sector is just this wanton willingness, it appears, to work more collaboratively, and to sort of this increasing understanding that not one sector can achieve all of what we need to achieve, be it governments, private sector, NGOs, that we really do need to work together. And I think from our perspective, to see that come through in this research is also very encouraging.
This report, I think, really highlights that health cannot any longer be deprioritized in national plans. Health is the core of society. It has, a virus, a pandemic has brought the entire globe to its knees, entire humanity to its knees. So we have to definitely critically focus on health as a priority across the world. And as Kylie just said, I think the key to that, especially for Asia Pacific, is collaboration. It's a very big claim, but no country in the world, and certainly no country in Asia Pacific, can claim to be self-sufficient in terms of health and cannot take preventive measures, if that's even possible, without collaborating across stakeholders, across countries, across regions. We need a whole world approach to healthcare.
When you look at, for example, the satisfaction level in some countries related to healthcare, it is surprising how high they are after 2 very difficult years. And obviously, it's not only healthcare policies that make this is a very complicated situation, but I'm still positively surprised by the satisfaction level. So what this tells me in one way is that good policies and communicating about, the work that healthcare providers and policymakers and pharmaceutical companies do, it does work. Having good communication and, having good policies is recognized by patients and the people.
Let's talk a little about that point. The importance of innovation and prevention, which rank as kind of lower priorities in terms of spending compared to hospitals and infrastructure. Kylie, you flagged this as well. The sort of break it and fix it approach is expensive, places pressure on health systems, is not necessarily geared to keeping people productive and well. So how hard of a communications challenge is this to make perhaps innovation and prevention a higher priority in terms of what people expect from healthcare spending? And how do you see that communications challenge being tackled?
I think as communicators, there will often be pressure on us from other stakeholders, be it internal or external, to include a whole lot of information. But the more that we can have that first paragraph or infographic in the back of our head when we're actually regurgitating the story, honestly, I think the better. And again, I don't want to underplay the sophistication of the message or the complexity, but I do think that is a strength of a good communicator, is to be able to, bring forth that information in a very clear way.
Ritu, over to you. I wanted to get your take on something that I know is kind of integral to your work here, which is the patient voice. And I don't know if there's anything in the research that jumped out to you about the importance of the patient voice, but how do you see that changing perhaps in this region? And do you think it needs to be perhaps afforded more attention?
And I come across this again and again, doctors say to me, so are you saying that we should put patients in the driving seat of their care? And I have to say, yes, you do have to do that for rare disorders, because as it is in the Asia Pacific, we have such a paternalistic healthcare system where doctors know best. So we're trying to subvert that and say, you do not know best about rare disorders. Just admit it, be humble, treat the patient, if not as the expert, then at least an equal partner. So without the patient as a partner, I am confident that no healthcare system can succeed.
Regarding the patient voice, it is absolutely important that, it be included in the discussion. They are one of the most important stakeholders in any discussion about health. But I've also seen, when you have patient groups and organizations who don't really have the capacity and the knowledge to actually do what you would expect them to do in terms of communicating what they need, and or using resources that, for example, government or other stakeholders might give them. So capacity building in terms of the patient voice is very, very important.
Kylie, do you think that is a challenge for the corporate sector? And how do you see them addressing that? Is it just about capacity building, or is more required?
I think there's a lot of ways that we can support, even beyond financial assistance, and sometimes these other types of support are even more needed than some of that more transactional financial support. Thank
you, Kylie. So Ritu, back to you. I mean, is this the kind of, I suppose, the collaboration that you're looking for from your perspective? And do you see perhaps other challenges as well in terms of language and culture?
What I would say to industry is, instead of working with individual patients, perhaps encourage patients to have alliances, single condition national alliances. What kind of support do you give other than money? I would say build certain priorities and require patient organizations to have a strategy plan that translates perhaps into providing better care to patients. Yes, that's always a priority, but something broader like skills and training that patient organizations can benefit from in terms of simply enhancing their communication ability.
All right, well, now we lose track. We are 2 years in to the pandemic. The pharmaceutical companies have really rallied, I think, to the kind of unique challenges. And this is a sector, let's say, diplomatically perhaps hasn't always had the best reputation or the best perceptions amongst the public at large. So Kylie, if I can come to you, pharma companies have been recognized for their role in overcoming the pandemic. How do they ensure perhaps they don't squander the reputational benefits of the past 2 years?
There is an opportunity for us to probably be a little more braver, to be a little more courageous, to really look at this research that's coming out, yours and others, which really does demonstrate that not only is there a role for us to play, but in fact the community expects us to play a role. We need to get more comfortable at taking a seat at that table on our own 2 feet, and to really bring to bear some of that extensive expertise and knowledge that we have to really support the overall policy discourse. So, we hear a lot about public-private partnerships. We hear a lot about alliances. To be more specific, I think it is good when companies actually work together, because I think that sort of shares, that sort of shares any sort of risk.
Is that every time you have a new vaccine or a new, innovative treatment, a new drug, a new medical device that comes out, and it's a technological or scientific or therapeutical breakthrough, of course that creates a lot of positive messaging and a lot of kind of good reputation for companies. But then the next question is always, how expensive is it, right? And that question basically ensures that there is a negative connotation almost to everything that relates to healthcare. Now, I do think that this is a difficult issue, but there are ways to focus on really the benefits, focus on not only the disease related and therapy related benefits, but also the economic benefits of new treatments. And I really do think that governments have to be also engaging in a responsible communication about this very, very complicated sector.
And I do think that the research demonstrates that we are kind of moving into a new era, perhaps, in terms of how people, what people expect in terms of healthcare, what their priorities are, and that can't be a bad thing. Let me thank all of you for your time, and in particular for really insightful responses that simplified what I think are some quite complex conversations around healthcare policy, healthcare priorities, healthcare services, and what all of this means for policymakers and healthcare organizations.